Move on to another topic here because one of our viewers sends in the question about the care of mental health patients and mental health needs in the state of Minnesota. The note here is that quite a few of our jails serve as sort of a de facto mental health institution, and you can talk to any sheriff in Minnesota, they'd probably agree. So given that dire straits of mental health care provision, what do we turn to? What are the answers we can seek?
There are many solutions to this more singular problem, but they're absolutely right that many people, and this is one of the pieces of it, that they are unable to get their medication refilled. They can't get in to see the doctor timely, or a nurse, or a physician assistant, or a nurse practitioner, because there's kind of a logjam in the current situation. And so being able to get their medications renewed timely is a big part of it, because when they go off their medications, it triggers a psychotic reaction maybe, or an issue, or a lack of control. And oftentimes, sometimes that may be when the police are called. And so that's what gets them into that. There's another, so one of the pieces is to help make sure that we have appropriate and sufficient quantity of providers so that nobody should be ending up in jail because of a lack of a renewal of a prescription that is much needed. That just should not happen. We need to make sure the right providers are amply there to take care of them. And I believe we have good Minnesota providers who would do that. We need to get that structure taken care of. And then when they do have a situation where they come in that contact with the police, one of the solutions, one of the bills that's making its way through is where you would have, say you come into a situation with the police, often starts there, and they sense or they see that this is more, has a heavy mental health component with it, they would call upon a provider again, but not after they're in jail, but before, and they might divert them then, instead of into jail, take them to a treatment center, which is where they really need to be, not in a jail. This is a health issue, a mental health issue. Now, if they've committed a crime with a violence, they've hurt someone, sometimes you've just got to have some control first before. So we'll leave that to the judgment of them. That's called kind of a dual track, kind of a dual situation like that. So instead of getting them in the jail, we take care of it ahead of time. Once they are in jail, having health care providers that can meet those needs as well and get them out of that jail. And so there are multiple things like that that I think can help the system.
A number of years ago, Minnesota moved from the heavy state institutions, such as the one that formerly was at Fergus Falls or at Moose Lake, and huge institutions. And we moved to community provision of health care services. And there have been those at county levels, at least, that I've spoken to, who find that there just aren't enough beds, if you will, in certain sectors of the state. So it would seem to me, at least as one start, would be, do we have enough beds? Do we have enough caregivers to meet the need when they do, for example, get out of jail?
I think that is appropriate as well. That is another piece of it. But I always like to go upstream. If it's a medication, get your refill and get it timely, and you don't have to go there, that's the first place to start, to make sure that you do that. And then downstream, if you can't take care of it there, then yes, having sufficient beds. And we have expanded already some of that, and there are other proposals as well to expand the availability of the beds. We've got great community providers who have a real heart of compassion to take care of them.
Good.